Assessment comparison analysis.
Hello, my name is Chelsea Baker. I'm from Southeast Missouri. I have 5 to 6 years of ABA experience. Most of my experience is with AACs for and nonverbal kiddos and apraxia clients.
Hi, my name is Emily Capshaw. I'm from Indiana. I have 4 years of ABA experience, and most of my experience is with nonverbal or severe behavioral children.
Hey all, my name is Michaela Bardolph. I'm from Auburn, Alabama. I have 2 years of ABA experience with children aged 3 to 11. I have most of my experience with nonverbal behaviors, severe behaviors, desensitization techniques, and play skills.
I'm Abby Berryman. I'm from Nebraska. I have been in ABA for 2 years. My experience is very much early childhood and early intervention. I have a lot of experience with ACC devices, along with social skills and learning how to communicate.
My name is Amanda Buell. I'm from Indianapolis, Indiana. I have 2 years of ABA experience after 5 years of teaching experience in a public school setting. My experience is primarily with severe aggressive behavior, communication skills, and naturalistic teaching.
The assessments that we chose to compare were CARS and GARS. CARS is the Child Autism Rating Scale created by Eric Schlafler, River Rachnier, and Barbara Rauschenrenner. It was first created in 1988, and the second edition was created in 2010. CARS is a multi-method approach. It has behavioral observations, interview with caregivers, assessment of intellectual functioning, and a detailed parental and family history. GARS is the Gilliam Autism Rating Scale. This was developed by James E. Gilliam. It was created, its third edition, in 2013, and it consists of 58 items grouped into restrictive or repetitive behaviors, social interaction, asocial communication, and emotional responses. These are all scored on a Likert scale from 0 being unlike the child to 3 being more like the child.
Our client is John Doe from Southeast Missouri. He's 7 years of age. He is from a low socioeconomic status. He is in a rural community. His present level of functioning is 2. His diagnostic is autism and ADHD. And we chose CARS for the benefits of specific treatment recommendations and diagnostic sensitivity. And that CARS is better at distinguishing specific disorders and our client's IQ.
So we ultimately chose CARS because the benefits outweighed the GARS benefits, including benefits such as determination of functional capabilities. It provides better feedback for parents. It designs targeted interventions, integrates diagnostic information. It breaks it down into 3 components: social communication, stereotypes, behaviors, and sensory sensitivities, and emotional reactivity. The components are reflective of the DSM criteria. There's a narrow age range, which allows for focus on strategies to use for diagnosis of children earlier to support early intervention. And it utilizes the factors explored in the study to allow for a more nuanced understanding of a child's ASD symptoms, and in turn, leading to a more tailored recommendation for intervention.
There are some limitations to CARS, as it's typically for younger learners, but it is more appropriate for our client's developmental level. GARS requires too much training, and it's less likely to differentiate between autism and other developmental disorders. It's also less available for families and schools with limited resources, and therefore it may be less available to our client.
The next step after completing the assessment would be the conclusion of the assessment would tell us specific interventions and recommendations based on their scoring of developmental levels. Moving forward, we would design, train, implement, and monitor interventions concluded by the assessment results.